শুভেচ্ছা দর্শক সকলকে আমন্ত্রণ জানাচ্ছি প্ল্যানেটারি হেলথ একাডেমির সুরক্ষায় প্রতিদিন অনুষ্ঠানে পাওয়ার্ড বাই ইউনাইটেড হসপিটাল। দর্শক, সারা পৃথিবীতে আমরা জানি মানসিক স্বাস্থ্য সম্বন্ধে সচেতনতা বাড়ছে এবং এই সময়ে দাঁড়িয়ে আমাদের ইন্টারনেট এবং তথ্য প্রযুক্তি কিভাবে মানসিক স্বাস্থ্যসেবা মানুষের দোরগোড়ায় পৌঁছে দিতে পারে সে বিষয়ে চলছে নানান উদ্যোগ। আজ আমরা এ বিষয়ে কথা বলবো এবং এই ডিজিটাল মানসিক স্বাস্থ্যসেবা সকলের কাছে পৌঁছে দেওয়ার ক্ষেত্রে সারা পৃথিবীব্যাপী যিনি কাজ করছেন সেরকম একজন বিশেষজ্ঞ, বৈশ্বিকভাবে স্বীকৃত একজন বিশেষজ্ঞ আজকে আমাদের অতিথি। চলুন আজকে আলাপচারিতায় যাই এবং আমাদের আজকের অতিথির সাথে পরিচিত হই। আমাদের সাথে স্টুডিওতে উপস্থিত আছেন প্রফেসর অনিল থাপলিয়ান। তিনি বৈশ্বিক মানসিক স্বাস্থ্যকর্মী, তিনি নির্বাহী পরিচালক মেন্টাল হেলথ ইন্টারন্যাশনাল কোলাবোরেটিভ eMHIC. Professor Anil Thaplian, welcome to our program.
I'm glad to be here.
Today we will discuss about the impact of and the implementation of digital mental health and its implications in Bangladesh and also around the globe.
Right.
So we're really privileged to have you here. We know about your leadership and different initiatives that you have taken around the globe. The very first question to you will be about the very basic thing about mental health or digital mental health. We know that mental health itself is a new domain for many countries. How do you see mental health or digital mental health in general?
I think the way I would like to respond to that beautiful question of yours is how communication has changed right in front of our eyes. Most of us would remember in 2005 the Facebook was launched and how far we have come in just that period of time, under 20 years. And there was a British research in 2017 which looked at how we are communicating these days.
Okay.
And the research is, the outcome of the research is quite startling, but at the same time makes sense. So it's looking at how we are using the smartphone. Now, I've been absolutely amazed at the hospitality in Bangladesh over the last 3 days. Been to most of the people's homes, eating home-cooked meal, sometimes taking a rickshaw to go to some places. But everyone has a mobile phone. Does not matter who it is, everyone has got a mobile phone they're carrying. So the study looked at how people are communicating using that mobile phone these days. And results are very startling because for the first time, making a phone call from phone has not made it to the top 10 activities we buy it for.
Yeah.
Number 1 is texting. And making phone call from your phone is number 11 activity now.
Okay.
So when we're talking about digital mental health, we are not talking about digital, we are talking about speaking the consumer's language. That's where the consumer is. So unless we speak where the consumer is, that language, we're going to miss the opportunity to connect with the person. So it's more about speaking the consumer's language and less about digital.
Okay. That's amazing, and it shows that how any subject can transform and utilize the best means of communication when the development has taken place in front of our eyes. And that's what exactly you said, like the internet and mobile telecommunications, it has revolutionized everything, and mental health is one of the domain that's been transformed.
Absolutely. So in 2007 in New Zealand, I was very fortunate to have led an initiative called the Lowdown for young people, so mental health, suicide prevention. And in the first month of that program being launched, it was predicated on texting and people receiving a human response from via text back to the young people. In the first 30 days, 19,000 young people accessed the service. 19,000 young people. So it was a Ministry of Health program. So our minister wanted to know a little bit more about who these people are.
Yeah.
So I was made a request that minister wants to see you in Parliament. So I flew down to Wellington, which is our capital in New Zealand. Went to the minister. The first question in the room was, where were these people going before?
Yes.
And I said, I didn't have a researched sort of a response for it, but off the gut response and from what we knew, I said probably nowhere, Minister. They were not going, they were not in contact with or in touch with our traditional mental health support services. So, and that led to another big initiative. So why aren't we doing it for the adult population? So we transformed the same principles into the adult population. So it was less about digital, even though we are using digital as a means. It is an enabling mechanism.
Yes.
But it's about more connecting them to the right support. And one of the other startling thing which happened is, so there were so many people, and we had to have appropriate resourcing for it, because people were receiving a beautiful human response. So for example, a 14-year-old Mustaq somewhere in Dhaka is having a challenge around study stress. It could be anything, all right? So you contact the lowdown service because the school guidance counselor gave you some nice fancy card which had nothing, no mental health mention. It said the lowdown, and there's just a texting number. So you text that number and you receive a response. Say, I'm in the call center, and receive on my screen, there's a text message, and message says, life sucks, you know, too much study and too much parental pressure on me to excel. So it could be something along those lines. Yeah. So a response from the center would be coming as a digital response back to you. Dear Mustaq, so sorry to hear that what you are having to endure and so much stress. It is a challenging time. Your mom and dad are fighting all the time. You know, is there anything we can do for you? Would you like to talk to somebody?
Yeah.
And you know, 1 in every 3 Mustaq will write back to us, oh my God, are you a real person? Because it's not an automated machine response. Yeah. It is so customized and tailored for Mustaq.
Yeah,
so the point here is about the magic lies is, digital is just enabling mechanism. Yes. Magic still is in humans.
Yes.
All right. So how we enable that, how it's tailored for each person, and all of a sudden Mustaq is engaged.
So using the right language and also using the right means which is acceptable to them. So I think this is the right place probably to ask the question also about your background, like in the mental health space. How did you get interested, and then how you find this kind of this magic mixture of utilizing digital means for better promotion of mental health to the people who will appreciate it?
Yes, so my training and background is in psychology. So when I was practicing, I was seeing 7 patients a day, and then 35 a week. You write half a dozen or so family court reports for the judges, or for domestic violence or anger management, whatever the case may be. You have supervision on top of that, and by Saturday you are of no use to anyone because you're exhausted. And I used to often wonder, are we making the difference? You know, because the person who I saw today for the first time has waited 18 weeks to come and see me. Is something wrong with the system? 18 weeks to come and see me for the first session, and then they have to wait another 3 weeks for the second session. So I thought to myself, I have always put myself in the shoes of the service user. What is their view of the world, of the mental health care system? Is it fit for purpose? Is it meeting their needs? So then I thought to myself, there's got to be another way. There's got to be a better way to look at how digital can improve access to information, because navigating mental health is not an easy task, even for the people who are in the sector.
Exactly.
Let alone you being an ordinary citizen in Bangladesh, living in the remote area, you don't know where to start, who to even ring. All right. So navigation is one thing. So information. So improving access to information, care, support, and treatment. So I just thought there is got to be a better way. So that meets your need when you need it, that information. At the moment, there are amazing range of solutions, but sometimes there is so much a supply of information, you do not know which one to rely on as well. Yeah. So there is no validation of what works because I worked with the governments of various nations over the years of my work. So I'm looking at it more from a systems point of view. Let's get it right for the nation from a systems point of view. Let's not build another silo. It needs to be integrated across. Because mental health, comorbidity across, whether it be the oncology or whether it be diabetes or a major heart event or whatever the case may be, you know. So we know it is relevant across all health disciplines, all long-term conditions. So, but what does it mean? What does the right response at the right point in time in the care pathways, what does it look like? So that's what we're talking about is, so my journey was, for a big part of when I started this 26 years ago, a lot of people thought, you know, how can mental health have anything to do with digital? It's quite amazing. So sometimes it's a question of leadership.
Yes.
You know, and I have met some of the foremost thinkers and leaders in my last 3 days here in Bangladesh. I've always had a soft corner for Bangladesh. I always think some of the greatest innovators come from Bangladesh. And it brings me nothing else but a sheer joy to see what I've witnessed in the last few days. Okay. So part of this, it's about leadership is there. What we need to do is inform that, and how do we build the next steps, you know, create the environment, the ecosystem. You know, it's just like simple principles of a small seed can thrive if it's got enough appropriate amount of water and the sunlight and good fertilizer, and of course it's going to thrive.
Yes.
So this is about understanding digital that is part and parcel of the care. It is no way in any shape and form replacing the traditional mental health support services.
Yes.
So we never, sometimes I get asked a strange question. So does it mean we don't need psychiatrists anymore, psychologists anymore? And I think we need to think of it as blended care.
Exactly.
There is a time and place for self-management where I may want to do it on my own because there are stigma reasons. So there could be other reasons. Maybe it's 2 o'clock in the morning, you know, but I'm finding it hard to go to sleep. Maybe it's an insomnia treatment program, which I can do on my own. Yeah. So there are 365,000 solutions out there. So, you know, so it is happening, and right now, 5 million people around the world every single day use digital mental health tools.
Wow.
So whether we prescribe it or not, we can debate as much as we want,
but
consumer is voting with their feet, they go and just do it anyway.
Yes, exactly. I think at this point, it will be very appropriate to learn about the international initiative that you have founded, eMental Health International Collaborative. So I assume that your understanding about the application of digital means for promotion of mental health, it obviously invokes the question how you can bring other people in the scene and combine their effort for the broader application of mental health for people who need it. So how eMHIC or eMental Health International Collaborative it initiated, what's the vision, and how far you think you have come?
It's been a very long journey, and a journey of sheer belief and conviction, because I think not everyone is here to chase fiscal outcomes in life, just monetary benefits. For me, it was making the difference, is to saying there is somebody out there, somewhere in Bangladesh, wanting to access something which they are not able to access right now. Right? So how do we, looking at that dark space, what can be done? All right. So what eMHIC does, fortunately, we are a mental health charity by establishment. Constitutionally, we are a charity. We have been working with so many governments around the world for such a long time that eventually the government of Australia, New Zealand, United States, Canada, Sweden, and England, they said, let's do something more in an organized manner. That's how eMHIC was established. Ever since that, Scotland, Ireland, Wales, Denmark, Singapore, we have Philippines on board, and I've got all the great indications from this visit that Bangladesh is very interested in becoming part of this global movement. Yeah. In addition to the countries, we also help organizations like UNICEF to develop global guidelines for adolescent and youth digital mental health. So we've got a big program of work, working with UNICEF in Geneva and New York office. We also work with World Health Organization. We also work with the United Nations. So, so there are World Federation of Public Health Associations. So we are working, because mental health cuts across to every aspect of the health discipline, as we were saying earlier. So, but one thing I always like to say is, if you think about digital mental health, if I use the word digital mental health, hopefully in 50 years' time, we will not be using the word digital, and we will call it mental health, because that's the way mental health is going to be delivered. All right. At the moment, we probably use it deliberately, because we need to get the design right.
Yes.
All right. So think of it that as a jigsaw puzzle. A jigsaw puzzle has got hundreds of small pieces in it. Some of them could be around self-management. Because some of the pieces could be around addiction treatment. Some of it could be for mild to moderate, and somebody for the acute end for tertiary care. So there are hundreds around accreditation and activation, around digital mental health framework, digital mental health standards, and the activation pathways. So whatever. So the hundreds of pieces, if you are to look at that as a jigsaw puzzle, no two countries are doing exactly the same thing. So they are working on different pieces of the jigsaw puzzle.
Okay.
All right. So as an international body, a peak body in digital mental health, our role is to facilitate that collaboration. So Australia in 2019, under the leadership of Dr. Peggy Brown, developed a world's first digital mental health standards. They are right in the middle of deploying them or implementing them across Australia. Now, if Bangladesh was to consider developing those standards, should they do it on their own, or can they government-to-government level collaboration with the government of Australia? And they would be more than happy to willing to gift it to you, and you simply have to adapt it for Bangladesh.
Yeah. Exactly.
Right? So, and vice versa, you are doing amazing things here, which I'm just so blown away with the amount of innovation. Even just this TV channel, 24 channel, it's amazing. So there is so much of other people can learn from Bangladesh as well. So it's knowledge flow is two-way, and I think, and this is where I say is, 1 + 1 = 11, not 2.
তিনি যে কথাগুলো বললেন, খুব অল্প করে যদি আমি আপনাদের জন্য বাংলায় বলে দিই। ডিজিটাল মেন্টাল হেলথ, তিনি বলছেন যে এখন থেকে 50 বছর পর হয়তো আমরা এটাকে শুধু মানসিক স্বাস্থ্যই বলবো, ডিজিটাল শব্দ আমাদের ব্যবহার করতে হবে না। কিন্তু এখন দেখা যাচ্ছে যে আমাদের তরুণ প্রজন্ম কিংবা যারা এই মুহূর্তে মেন্টাল হেলথ সাপোর্ট নিচ্ছেন, তারা কিন্তু মোবাইল ফোন অথবা ইন্টারনেটের যে সার্ভিসগুলো ব্যবহার করেন, সেটা কিভাবে আরও ভালোভাবে মানুষের কাজে লাগানো যায়, এবং মানুষের ভাষায়, তারা যেই ভাষাটা সবচেয়ে ভালো বোঝে, সেই ভাষায় কিভাবে উত্তর দেওয়া যায়, এই বিষয়টি নিয়ে কিন্তু তারা চমৎকার কাজ করছেন বিশ্বব্যাপী। How do you see it regarding its future activities and the destination where it's heading to?
Yeah, it's quite a huge undertaking for a mental health charity or an NGO organization like ours, but we've been international from the day one of our foundation, so it's comes naturally to us. So one of the first major initiative which has gone on to become a huge success is what we call it a government-to-government level collaboration. So there is no intellectual property kind of matters, issues there, because over there government of Australia is working with the government of Denmark, for example, so they can do a knowledge transfer. So we call that initiative brag and steal. So one country brags, another country can steal the idea. So this is it's a very simple but concept was introduced to eMHIC by US government. So they have this in US, brag and steal, and I just love the concept, and I love it for its simplicity. So it needs to be simple for it to be effective. And so what does a brag and steal looks like? We also have a range of initiatives. So we have world's largest, knowledge bank around digital mental health. So if people want to know what's happening in the policy space in this area, or around how do we know what what is accreditation of these digital mental health tools looks like, and how many of them are safe and effective, and all those sort of things. So there is a whole program of work around Knowledge Bank, which we host, which is also accentuated by some newsletter, which is a monthly newsletter. So people want to keep abreast with what's best and the latest and the international best practice looks like. So we would be disseminating that through our newsletter, monthly newsletter. Okay. But on top of that, there are things like the roundtables, which you host in different countries. So I've got 5 coming up, and 3 in Canada in 2 weeks' time, 1 in the United States in Indiana, and 1 in Cardiff and Wales. And we just finished only last month 6 in Australia and New Zealand. So these roundtables are invitation-only events. And the main purpose of that is not the digital mental health should not be the purview of only the Ministry of Health sitting in Dhaka. Yeah. It should be the community engagement and community empowerment. So how do you take the entire nation on a journey with you, rather than just a few getting excited in ivory towers? So I think it's very fundamental to the engagement and empowerment, because that's where the magic is going to come from. Okay.
So we heard that there is an Mental Health Congress happening in Canada. It's 9th eMHIC Congress that you're organizing. What's going to be discussed in that Congress, and how many countries are attending there? Is Bangladesh also going to be a part of that Congress?
Yes. I'm delighted you asked this question. I'm so super excited that Bangladesh is going to be there. Okay. And we have Dr. Tasdiq Hassan from Bangladesh is going to be waving the Bangladesh flag at the Congress. And so it is the world's largest event of its kind in digital mental health space. So, so for Bangladesh to be there in the official capacity, and at the request of some of the key people from Bangladesh, we've also included Bangladesh in the International Leadership Excellence Awards category as well. Wow. So there will be some good news which will be made known on the 19th of September this year, when the awards are officially announced at the awards ceremony night. And those people also get inducted into Digital Mental Health Hall of Fame. So that's a lifetime sort of achievement. So 1 person per country gets that. So it's so it's an absolute honor we are going to be commencing the journey with Bangladesh. So this year's Congress was a result of a survey we did around the world with all the ministers of health. We looked at what is your biggest pain point in your country, and unfortunately, the same pain point is the common across all countries, regardless of where they're from. And that is recruitment and retention. Yes. Recruitment and retention happens to be the #1 biggest pain point. So for that, this year's Congress theme, and the discussion over many days, is digital building capacity. It's no more a fringe innovation. It's not about somebody who's computer savvy. It's across the board, digital building capacity, and 24/7 mental health support for all. We know crises don't happen just Monday to Friday, 9 a.m. to 5 p.m. Sure. So what does a 24/7 mental health support for all looks like? So that's the theme, and there is going to be a think tank to which Dr. Hassan has also been invited to participate on behalf of Bangladesh, because that think tank is invitation only for 50 experts from around the world. And that one is going to look at the clinician engagement and workforce development. We can't expect to not invest in that and expect people to just learn it through the process of osmosis. Exactly. It's not going to work that way. So we need to be a lot more informed what the good looks like. Okay,
wonderful. We're really, really happy to hear the active participation of Bangladesh there. You probably already know that Bangladesh, especially the current government, that has the slogan Digital Bangladesh. So digitalization of Bangladesh and different services is a main agenda. And Bangladesh is also now graduating to a smart Bangladesh, where even they're trying to integrate more digital services and technologies to different sectors. So during your visit to Bangladesh, what is your experience? What have you seen regarding digital services and also its applications in mental health in Bangladesh, and overall your impression about Bangladesh in general?
Well, great food. I love Bangladesh, but even greater is the conversation, because this is, for me, this is substance of the conversation determines the quality of the thought leadership you have in this nation. You are literally, everyone is walking around is an exceptionally intelligent person who could be equally successful in some other part of the world. Doesn't matter, you can take them wherever. So when I met a group of leaders from, they're all from the faculty for Student Medical Association, they came to see me a couple of days ago. I literally had tears in my eyes to see. For me, when the reason I had that, I became so emotional seeing the, is because they are the future of Bangladesh.
Yes.
They are the future, and they're asking such smart questions. Sometimes they're talking about maybe that today's curriculum is not fit for purpose. So they're talking about things, and they're talking about leadership, how to bring about change, how do you even take the next step. So it was such a powerful, lifting conversation at many levels. And that is, to me, that's where I get the hope from, you know. If this is the caliber of people who are asking the right questions, but at the same time, I also say to most people is, nobody out there in the Ministry of Health sitting there thinking about how do I make life of my citizens difficult. Everyone is wanting the best. It's just that everyone is working in their own constraints in their own departments. All right. So that was a beautiful meeting with the future of medicine in Bangladesh. This amazingly, I can just see them in 10 years' time. I'll be coming here. Some of them would be Director General of Health or something. But isn't that a beautiful thing? The second thing is, I met so many amazing organizations here. And so PsyCure, amazing leadership in terms of what the role of digital and improving access looks like in mental health. I met another amazing organization, and I just love the brand name, the Moner Bondu, and this beautiful people. This is exceptional leadership. This is, for me, the founder, Sharupa, is also the reason I name her particularly, because to be in digital mental health, in digital, and being a woman, it's twice as hard to get it right. Exactly. We need to celebrate leaders. We don't need to make it difficult for them. We need to say, how can I support you? How can I take you to the next level of performance? And we need hundreds of Moner Bondus and hundreds of other PsyCures because the need is so huge. 170 million people. You know, and most of your workforce of 400 psychiatrists and 520 psychologists lives only within the urban areas.
That's true.
67% of your population has no provision of formal mental health care systems for them available. So for me, the need is so huge, and government alone on its own can never meet the full demand. So how do we, the community engagement, empowerment I talked about, Moner Bondus and PsyCures of the world, we need more of those and support them.
Yeah. Thank you so much, Professor Thalperlian, and really, really happy to see that you have taken such a good view about Bangladesh, and I hope that it will help Bangladesh also to go to the next level. Professor Thalperlian, it's really, as I said, heartening to see the good review about Bangladesh. But if we want to excel in digital mental health or in mental health in general, what will be your suggestions, especially regarding policy and infrastructure?
Yeah, I always say we can either get it right in two ways. One is by default, another one is by design. So it's up to people to choose which path we want to go down. Majority of the responses from around the world would be they want to get it right by design. So if you want to get it right by design, we need to understand the ecosystem and the beginning and the end in mind as to what does it look like. And it could be around what gets focused is what gets done. So if there is no mandate for digital mental health interwoven into the way we structure and commission services, then it's not going to happen. So many countries have done that beautifully, and by how did they get it right by design? And And so how do we work? So how do we become part of the international movement or international best practice? And so digital or mental health is not a geopolitical issue. So we need to look at what's working in different settings, and how can we collaborate and bring that evidence-based approaches which are again then adapted for Bangladesh here. So I think getting it right by design from a strategy and policy point of view would be number one, and becoming part of this international movement. Yeah. We can't just sit outside the fence and think it's going to happen on its own. We need to contribute, and you've got some exceptionally good, high-quality thought leadership in this country, and I just would welcome Bangladesh on those think tanks and roundtables.
Thank you so much, and we really hope that and believe that the collaboration and the assistance that you will provide from your organization and also other international organizations, I think it will help Bangladesh to reach to the level where we all want to be. This is going to be my last question, but I think from a completely different angle. We are now living in a situation, in a society, in a world where digital means, whether it's a mobile phone, whether access to internet, these are often considered as disruption for our both physical world and also for mental health. It is, I think, from different research, it's been also been shown that the digital toxin, the word that is now being used, that is also, I think, a global phenomenon. So in this scenario, how do you see this digital mental health will help us to kind of get rid of the difficulties or the challenges that this digitalization of the world has posed to us?
Very good question, and I would like to say there is a beautiful piece of research that came out last month from San Francisco. There is a beautiful, large research establishment they called Hope Lab. Hope Lab has come up with some research just on this matter, around looking at the role of digital or internet and social media and its relevance within health. So they acknowledge the majority of the research that has been funded is looking at the harm the digital causes, with the social media. Okay. You know, so your response is exactly commensurate with what you have funded the research for. So that's what it measures and that's what it tells you. Okay. What they're saying is nobody measures the benefit it does. All right. So what they're saying is the research is such a balanced report, and I'm happy to share that with your viewers and send you the links to the research. What it's talking about is let's not throw away the benefits it has. And it's just like drinking alcohol, you know. Having a glass of wine once a week may not cause you much harm, but drinking 2 bottles a night probably is going to cause you harm. It's the same thing. So what does a good look like without it becoming toxin, as you call it? So my thinking is absolutely we need to get it right by design, and so there's accreditation pathways for what are the safe and effective tools. So most countries are developing the criteria, and New Zealand Ministry of Health, where New Zealand is, I should have said it in the beginning, New Zealand is where I live, where Ministry of Health has developed guidelines for what is a good and safe and effective. So they are pre-approved by the government. So we know the ones that are safe and effective for us to commission and put out there, and the ones which have not been vetted, we would not recommend them as a part of the Ministry of Health suite of approved digital mental health services. Another thing is also looking at when we talk about digital, there are 2 aspects. One is high complexity and low uptake, because it's only very certain amount of people who that will be prescribed to. But they are low complexity and high volume. Yes. So if you're talking about the general well-being, I'm having difficulty around if I'm a garment sort of factory worker and living away from the family. There are issues around finance or just separation or whatever the case may be. So some of those low intensity, low complexity, but high volume could be done. And so it's more about the prevention we're talking about, rather than becoming ambulance at the bottom of the cliff. So there's a lot of preventative measures can be done. That's why they will be low complexity area but high volume.
Thank you so much, Professor Anil Thaplin. It's really a great pleasure to have the discussion with you and learn about the different aspects happening in digital health, especially in digital mental health. Thank you so much for your time.
I'm delighted and thank you for this invitation. Bangladesh has a very, very special space in my heart, so thank you.
Thank you so much. দর্শক, শেষ করছি সুরক্ষায় প্রতিদিনের আজকের আয়োজন। আমাদের সাথে ছিলেন বৈশ্বিকভাবে অত্যন্ত স্বীকৃত এবং সম্মানিত একজন মানসিক স্বাস্থ্যকর্মী প্রফেসর অনিল থাপলিয়ান। তিনি যেই কথাগুলো বললেন এবং বিশেষ করে সর্বশেষ যে কথাটি তিনি বললেন যে ডিজিটাল মাধ্যম আমরা যখন ব্যবহার করছি সেই সময় ডিজিটাল মাধ্যমের ক্ষতিকর দিক নিয়েও কিন্তু অনেক আলোচনা হয়, অনেক গবেষণা হয়েছে, কিন্তু এর ভালো দিকগুলো কিভাবে আমরা সকলের কল্যাণে ব্যবহার করতে পারি সে বিষয়টিও কিন্তু আমাদের ধারণায় রাখতে হবে এবং এ বিষয়ে গবেষণা করতে হবে এবং সেই বিষয়টি তিনি আন্তর্জাতিকভাবে তার কর্মকাণ্ডের মাধ্যমে তুলে ধরার চেষ্টা করছেন। আমরা চাইব তার এবং অন্যান্য যেসব কর্মকাণ্ড বাংলাদেশে চলছে সেই কর্মকাণ্ডগুলোর মাধ্যমে আমাদের মানসিক স্বাস্থ্যসেবায় একটি গুণগত পরিবর্তন আসুক। এই প্রত্যাশা রেখে আজকের মতো শেষ করছি সুরক্ষা প্রতিদিন।